Hello, everybody. That's Vincenzo Piccolo from University of Campania, Luigi Vanvitelli. And today I'm going to talk about cutaneous findings in neurofibromatosis type 1. Before starting, I want to present you the new revised criteria for neurofibromatosis. The most important piece of news in this criteria is that the only presence of capsulate macules and freckling is not sufficient anymore to make diagnosis of neurofibromatosis, but you need to confirm it by genetic confirmation, genetic analysis, because the presence of these two cutaneous criteria together could also be associated to the so-called Legius syndrome. The neurofibromatosis type 1 is the most common rhasopathy, and as we found in this very interesting paper, the genetic mutation is found in about 85.1% with the mutation of the so-called NF1 gene being the most commonly found at genetic analysis. The most important and common and early cutaneous findings is the presence of this very characteristic macule on the skin that has been called capsulate macule, with this very sharp border, like this patient, reminding the coast of California. Capsulate macules should be more than 6 in number, 6 or more than 6, and with a diameter that is over 5 millimeters, like in this patient. This is a combination of capsulate macules with some freckling that is the new criterion I'm going to show you. In this patient, the presence of multiple capsulate macules together with a very extensive Mongolian spot that spared the capsulate macules was highly suggestive for neurofibromatosis type 1, then confirmed by genetics. In this case, the capsulate macules does not belong to neurofibromatosis type 1 with this indented border that have been called main coast-like borders that is not quite typical of NF1 or neurofibromatosis. That's to say that capsulate macules, isolated or also multiple, but a small number, can be associated also to normal genetic in some patients. Sometimes we can find these segmental capsulate macules that only rarely can represent the presence of a segmental form of neurofibromatosis. Another very important criterion that I told you before is the presence of this small freckling on axilla and groin, that is called crow sign, and it is very characteristic and early in NF1. This is another patient with a combination of capsulate macules and freckling in the inguinal region. The presence of neurofibromas is probably the most striking finding in neurofibromatosis, but is not the most precocious clinical sign seen. This is on the left, we have a deep neurofibroma, and here on the right, another variant of neurofibroma itself. This is a patient, adult patient with multiple pedunculated neurofibromas that represent a very important reason of aesthetic concern in this patient. This is a plexiform neurofibroma originating from a peripheral nerve sheath, and this is a very important condition for the patient because associated with a lot of discomfort and symptomatic or pain or neurological symptoms or signs. This is a paper about cutaneous findings in neurofibromatosis type 1 published by my group a few years ago, in which you can see all the characteristics of the cutaneous findings that I showed you before, but other findings can be seen in neurofibromatosis, and I will briefly show them to you. First of all, the presence of, together with the other criteria, and it is very precocious, and I invite you to look for it if you have a suspicion of neurofibromatosis type 1, is the presence of the so-called anemicus nevus or nevus anemicus, that is this vascular nevus that can be seen after rubbing on the skin with this white discoloration of the skin, and it is very, very characteristic in patients with neurofibromatosis. And finally, before concluding, juvenile xanthogranuloma, it has been associated with a higher percentage in patients with neurofibromatosis. So the presence of it, together with multiple capsule-like macles, should arise the suspicion of the syndrome, although there are not any other criteria. So to conclude, please, let's learn together to keep in mind which the cutaneous findings of neurofibromatosis are. Just to summarize, capsule-like macles, multiple and with sharp border, freckling, neurofibromas, nevus anemicus, and juvenile xanthogranuloma. And that's it. Thanks for listening, and see you next time. Bye.